biology. At UCSF, he serves as the coordinator for the patient support for ambulatory behavioral health system. Daniel?
There we go. So thank you for the introduction. Yes, so my name is Daniel Duaybis, and I have 5 minutes to tell you how undergraduates like myself are currently helping extend social worker capacity here at UCSF while simultaneously increasing patient access to behavioral health care. I'll start off with some background. So we've established that UCSF primary care providers very often refer patients for behavioral health care treatment, whether that be outpatient therapy or any psychiatric services. But despite that large need, there's a very constrained capacity currently in the Department of Psychiatry and Behavioral Sciences, meaning very limited outpatient therapy services and a 6 to 12 month waitlist for new psychiatry patients. And so many patients often need care and benefit from care sooner than is available. And so to combat this, the Office of Population Health created the Behavioral Health Navigation Team, which serves to connect patients with behavioral health care sooner outside of UCSF. And since 2021, patient support corps interns like myself and those you see on this slide have assisted in this process. And so as interns, we are pre-health undergraduate students who earn either an academic credit or stipend and are badged either as affiliate employees or student clinical ones. And so next, I'm going to walk you through the process that a patient goes through when they are referred to us, to the team. And it all starts with the primary care provider creating the referral. Once they create that referral for the patient, it'll add them to a customized work queue that we have in Epic, our electronic health record. And so once that's in the work queue, our practice coordinator or social worker will go ahead and reassign that referral to an intern. That reassignment being logged in the system as a status change in the referral. And so once the intern has that referral, they'll go ahead and they'll scan the provider notes and the patient's insurance coverage so that they can then pull from a database that we keep and send a MyChart message to the patient with a list of in-network options to meet their needs. And so after that, we follow up the MyChart message with a phone call where we clarify any questions that the patient may have and address any concerns. These last anywhere from 1 minute to 30. So once that's all done, that's our process. The intern then documents everything that happened and closes the referral. That closure also being logged as a status change. So the reassignment and the closing of the referral being logged status changes, that served as the metric that we counted in order to log a measure of workload. And so here are the results. We found that in a 6-month period between August 2024 through January 2025, UCSF Primary Care referred 2,116 patients to the Behavioral Health Navigation Team. And of those, only 88 of those were seen by psychiatrists embedded at our primary care clinics, which meant that roughly 2,000 received resources to be seen out in the community. And so during that time period, 4 interns worked a total of 550 hours and logged a total of 1,174 of the total 8,410 status changes or work units. And that reflected around 14% of the total workload and roughly 300 patients, averaging around 4 status changes per referral. And so because of that success, with the team moved currently to the Department of Psychiatry and Behavioral Sciences, they are adopting this PSC model to continue the work that we do and expand throughout the department. And the thing about this PSC model is that it is portable and can be implemented in other departments where undergraduates like myself and the interns you saw earlier learn patient communication skills, professional skills, and gain exposure to clinical systems while also making measurable impacts on patient care and patient advocacy here at UCSF. We're currently doing that also in the kidney transplant center, the breast care center, and the Office of Population Health, among other places. So if any of you are from departments you think would benefit from PSC services, please do not hesitate to contact the director and a mentor of mine, Dr. Jeff Belcora, or speak to me and I can connect you. Thank you so much.